Vice President of Global Health at Johnson & Johnson. Johnson & Johnson is the founding sponsor of Text4baby. Without Johnson & Johnson, Text4baby's content development, product development, making sure that actually gets to everybody, the grassroots partnerships that we've been able to develop, the communications, the research and evaluation, all the different components that go into this program would not be possible. So thank you very much, Johnson & Johnson and Scott Ratzan, for being here today.
Well, thanks, Sarah, and really thanks to all of you for joining here today to hear about this, and Senator Carper and the support of all of you at different parts of the government. It's great to be here. As Sarah mentioned, I'm proud to be part of Johnson & Johnson. I was just telling Steve, it's my 10th anniversary today of J&J. Although we're a 125 years old company with a long experience in maternal and child health, and that's what actually made it so nice and wonderful when Judy Meehan at Healthy Mothers, Healthy Babies approached us with Paul Meyer and Voxiva to really look at how we could work together with the White House, CTIA, and others to really make a difference for women and children. And I would say now, 2 years later, long gestation, but many, many women, of course, 340,000 plus you'll hear more about. And it's great to see Natasha and others who are the people that we only count as a number, but really in reality, we're hoping to reach many, many more. And to hear the senator say how important it is that it's one of these trees in the forest, and you know everybody here to do a clarion call to get the message out. And the state enrollment contest is just one example. I have a couple of slides as they've given, because as I say, a public health physician, we have to remind people infant mortality is a real issue in America, and it is a disparities issue in America. And we have to do our best to try to get this country better informed and engaged. And one of the beliefs that we have at Johnson & Johnson, and what I've been doing for a number of years, is health literacy. So Text4baby is one of these health literacy opportunities to give women and other partners the knowledge and skills to make appropriate health decisions. And we believe that Text4baby, as mentioned, also will simplify the system that we all have to navigate in this incredibly complex world. The other numbers, of course, that are up there talk about access. And as Steve and others have said, we have already begun to see great strides in research. And I know we're going to hear a little bit about that, about how this service has had an impact upon women's lives and their babies' lives. As we continue through the slides, this is a complex slide which is not expected for everyone to read, but to remind them there is a research and evidence base when we approach these issues. Even though this is new and improved, and we know that everybody might have access to a phone, there still is a science of how we develop these messages. And through the partnership with the Center for Disease Control, through the work that our company, Baby Center, had with knowing the consumer and the mom, through the work of all these other departments, whether it's Emory Health Literacy Department, to state departments, to non-governmental organizations, civil groups, women and patients, and other partner groups, we've been able to follow this evidence base of looking at the literature, the topics, the audience testing, and we continue to make this better. And as you see on the other slides, we also address public health issues as they come to play. So, for example, smoking cessation. Everybody knows it's important not to smoke during pregnancy, but knowing it's not enough, that women need support and other services. And we found that smoking cessation is an issue also where we're partnering and see some tried and true practices that the National Cancer Institute has done in this country. So we're happy with that. But as you continue through, particularly immunization, another big issue, is women get their flu shot. And we have found through Text4baby already with our evidence, as well as some other randomized clinical trials that were actually just published in JAMA last month, that text messaging is making a difference for women getting flu shots. It's a huge advance, and if we can continue to do that through the course of life, will make a huge difference. And of course, the other areas, car seat safety, when the AAP, American Academy of Pediatrics, reminds women to put their, and dads too, right, to put your kids in rear-facing car seats up to age 2, we're able to also text moms and remind them of that. So there's all sorts of ways of using this in ways that you may not have thought about. And then finally, when we hear from the government, there always will be, whether it's recalls, outbreaks, other public health issues. We've also done our best, and I know with 7 states with the pertussis outbreak with the CDC in July of 2010, we were able to get messages out, other ones that you can see that are there, and this continues to be an ongoing piece. And what's most exciting also is with CMS also having their enrollment launch this year to get more women and children on insurance programs that are available to them in this country. That's another really important piece to access and addressing health issues. So I would say really at Johnson & Johnson, we've been real happy to be a part of it. We really want to thank you. It's great to see all of you here and continue to see the smiles upon those that are working, and Sarah and others that are really keeping this campaign going. But I would also say our colleagues at J&J, and not just the 110,000 people working around the world, but also our families and the ability that we have through the fine work of Susan and others who are here to continue to help get this message out. You have our commitment to make Text4baby a success and continue to work